Hey friends, what's up? Right at the top of this video, I have two bits of housekeeping, two disclaimers. The first is that in this video, I will obviously be discussing cancer. I'll also be talking about the death of a sibling and surgery. And so if that is something that is hard to hear about right now, or something that would be triggering, please, I implore you to take care of yourself and come back to this when you want to, if at all. The second thing is that if we know each other, if we are related, I am making this video for information purposes for people who need it. And so if we haven't talked about this one-on-one, I ask that you respect that boundary. And just transparently, I haven't talked very openly about my surgeries with very many people beyond saying that they happened. So, please don't take it personally. So, as I mentioned, I want to make this video because it took me about 5 years to ultimately decide that I wanted to have bilateral preventative mastectomies, prophylactic mastectomies. And so I'm making this for people who just might not see themselves represented in this previvor space. If you're not familiar with the term, previvor means somebody who is at an increased risk for certain conditions. So for me, I didn't see a lot of people who are young. I had surgery at 31, but I started getting genetic counseling done in my mid-20s. That, even in the previvor spaces that I've been in, that's still incredibly young. And then I also haven't really encountered too many Black folks. So, if you're on the fence about whether or not to have surgery, I just want to offer some insight as far as my path and the decision-making that I did with my care team and what led me to have surgery. So, a little bit of background. My oldest sister was 16 years older than me, really like 15 and a couple months, because my birthday is at the beginning of the year. But anyways, she was like 15, 16 years older than me. And she was diagnosed with breast cancer when she was 36. I know she had one mastectomy. She didn't get both done, and I'm not entirely sure what exactly her treatment looked like. But she was receiving care. Our grandfather is an oncologist. And ultimately, her cancer metastasized, and she passed away from breast cancer at 40. That is very, very young. And that also happened in 2020. I'm reluctant to say once the shock wore off, because I don't think that a sibling passing away is something that ever really makes sense. But once it became real, like, okay, this happened, I then had to talk to my doctors and realize that her death had implications for my health. And so I want to say that it was my gynecologist at the time who put me in touch with a geneticist. I'm not 100% sure, but I think it was my gynecologist. And reason being that, how gynecologists are the ones that do like your full annual exam for your reproductive system, and they're the ones that like check breast health and stuff like that. So not 100% sure, but I know for a fact that the year after my sister died in 2021, I met with a geneticist and got a gene test, got genetic testing done. If I'm not mistaken, I want to say it was just a cheek swab. It might have been a blood test. It was 5 years ago, I'm not sure. But it was super easy to do, and it only took a couple weeks, if not maybe like a month or two, to get the results back. And once the results came in, My geneticist at the time told me that I had a BRCA2 mutation of unknown significance. And if you are watching this video, if you are part of this community, shall we say, then you know that BRCA mutations, they explain breast cancer diagnoses, although I'm not sure on the statistics on like how many people that end up getting breast cancer have those mutations. But as far as it goes for being a previvor, a lot of previvors have the major BRCA1 or BRCA2 mutations, and that's what leads them to pursue surgery because their risk is like very high. So I got my results back in summer 2021, and the results said that I had a BRCA2 mutation of unknown significance, which means that there was something there, but it was just understudied. It wasn't as well known as the other BRCA1 and BRCA2 mutations to know for certainty, like, we need to be aggressively on top of this. And to my knowledge, I still to this day don't know whether or not my sister had a BRCA mutation, and she also was my half sister. We shared one parent, and so that I want to say also had implications for my genetics because we didn't know if it was from one side or the other as far as genetics. We didn't know which one it was, right? Like if it came from her mom and her and I have different moms, what does that mean for my health? That type of thing. So the recommendation at the time was to, I want to say, like, keep an eye on it, just be aware of it, but nothing really came of it then. So I ended up switching doctors. I was in the process of moving, not like anything happened. And through that gynecologist, then they recommended that I see a breast surgeon to work with somebody who's really specialized on what the best course of action is. Something that I really appreciate is that now I have a team of doctors, but at the time I think I only had a primary, but she was part of a healthcare network. And that was beneficial because it means that, like, if I do need to have surgery or find a specialist, they're able to refer me to people easily. I'm able to be seen relatively quickly, and then my chart is there. So just something to be considerate of. But I got connected to my breast surgeon, who's absolutely wonderful, and her recommendation for me was to do rigorous prevention. And so what that looked like was on alternating every 6 months, I would alternate between getting a breast MRI and then getting a mammogram and an ultrasound. The goal of that was to just keep an eye on everything, make sure that nothing was, developing or coming up. And the goal was that should there be something that was abnormal, they would detect it so much quicker than what happened with my older sister. That sucked. If you've ever gotten, testing like that done, especially something like of that weight, right? Like I'm trying to find out if I have cancer or not every 6 months. That did a number on me. And so I want to say I continued that for about a year. And what ended up happening was I had an abnormality on one side. And so I ended up needing to get an MRI guided biopsy done. Thank God it was benign, but that was my first cancer scare. And at the time I want to say 29. I think I was either 28 or 29 when that happened. And so my surgeon was wonderful, and she reassured me that again, the goal of this testing is really just to establish a baseline that in her words to me, this is not medical advice, but in her words to me, everybody's anatomy is different. There's different lumps and bumps places. And so, you know, it's good to just see what's what, test it, see if it stays the same. If it's not growing, if it's not cancerous, then we just leave it. And so I got a biopsy done. And then I want to say my next round of testing, I had an abnormality on the other side. For me personally, the biopsy was one of the hardest medical things that I've experienced, because the anxiety of waiting to find out whether or not I had breast cancer was very scary. And I don't want to scare anybody by saying this, but for me, the procedure itself was also really difficult, is what I will leave it at. So when I was 29, about to turn 30, they found another abnormality during routine testing. And at that point, I knew my experience with getting testing done was that in the weeks leading up, I was riddled with anxiety. And then at that point, every time I was getting the testing done, they were finding something, right? Because the first time it was, and to tell you the truth, even beyond just not getting all the way into my medical records, I also don't recall how many rounds of testing I got done. I just know that I started in 2023 and had surgery in 2026 with the testing. But every time I would get it done, they were finding something. And it wasn't even like it was just on one side, like it was switching sides. So I got to the point where I was like, I think I want to get surgery. And so I talked to my surgeon about it. Again, she's lovely. And her recommendation was maybe just, as far as surgery, right? I wanted to get mastectomies. Her medical opinion was, for me, this is not medical advice, to essentially get part of my breast removed, where they found the abnormality, the lump, but not go all the way with mastectomies, because you can't undo that, obviously. And so I thought about it and eventually just got to a place after maybe a month or two of deciding that, no, I think I want to move ahead with this, because every time I do testing, y'all are finding something, and I don't want to essentially have to go through that because of hypothetical children or because of how young I am or whatever, right? So I went as far as meeting with a plastic surgeon right after I turned 30. And then I had a bunch of other stuff happen with my health. I actually planned on having the mastectomies when I was 30, but then I ended up needing a different surgery. I've talked about this before, that I had fibroids, which is its own experience when it comes to being, you know, young and Black and not listened to. But that got derailed. So once I had healed up from my fibroid surgery, I went back to see my breast surgeon. And I also, by the time that I had planned on having the surgery, the mastectomies, I'd never had surgery before. So once in a way, fibroids are like a benign tumor. I wanted to know, like, should I be back on the path of getting mastectomies? So let me just pull up some statistics. So between my genetic results and also family history, essentially I had a 50% chance of getting cancer. The average person had a 0.13% chance of getting breast cancer. If you factor in age, so for my age group of being 30 to 34, I had a 50% chance of getting breast cancer. The average 30 to 34-year-old has a 0.032% chance of getting breast cancer. So if I did my math correctly, and if I don't check me, that's not the point. But if I did my math correctly, I was 15 times more likely to get breast cancer than other people my age. Now, evidence that God is real. The day of my wedding, I was literally like just waiting to get called in for me and my husband to say our vows at the courthouse. The day of my wedding, my new genetic counselor called me. And again, she's lovely too. She was super fun, super cool. But she called me to say that my mutation had been further studied and was reclassified to benign. And I remember going up to my husband, well, at the time, my fiance, for the next 30 minutes and saying, it got reclassified. And he's like, this is a good thing, right? So yes. So that 50% chance of getting cancer is just based off of my family history, not even having to do with BRCA mutation, just because of how young my sister was when she got cancer. So I ended up talking to my breast surgeon about what to do with that number, right? Like, what does it mean to have a 50% chance of getting cancer at 30? And so what we landed on was I just wanted to get the surgeries because for my quality of life, and at that point also, I bring up briefly being married because it wasn't just about me anymore, right? I also had to factor in how does my well-being play a factor in my marriage? What happens if I get breast cancer and then my husband has to take care of me? What happens if I'm just always waiting to get the results? And that's really how I felt, was that I was essentially waiting to get the worst news. And I'm kind of just sitting for 6 months at a time. But every time I was getting testing done, they were finding something. Recall that when I was about to turn 30, they found something on the other side. I wasn't able to get it biopsied because of where it was located. And so they recommended, let's just take some of the surrounding tissue out. So then when I was about to turn 31, my breast surgeon, once she heard all of my concerns about just the anxiety of getting that rigorous prevention done, said, let's do one more round of testing and then let's start planning for surgery. So I got one more round of testing done, and that abnormality from 29 was still there at 30. My surgeon suspected that it was a benign tumor, but wanted me to get a biopsy. And like I said, that biopsy was a really bad experience for me. I remember calling my husband, and I remember calling my husband at work and telling him they want me to get another biopsy done, this time on the other side. And he said, you're not getting another biopsy. Let's just plan for surgery. So the nice thing is that I had quite a bit of time to really weigh if getting mastectomies was the right decision for me. I had about a year. And again, this process took almost 5 years, from first getting the genetic testing, 3 years of rigorous prevention, and really just having data, to then making the decision. And so right before my 31st birthday, I met with my plastic surgeon again. If you have questions as far as like reconstruction, what I got done, let me know in the comments and I'll make another video about it, but I feel like it's not worth, telling all my business if nobody cares, right? But I worked with both a plastic surgeon and a breast surgeon, and made the decision. And so for me, it really came down to quality of life, right? Yes, I could have all of my God-given body parts, but if every single time that I had to get preventative testing done, they're telling me, we gotta poke you, we gotta see what the hell this is. It's for other reasons, I could not handle that. After I got my surgery done and they had to send my breast tissue and lymph nodes off for pathology, they found that that little mass that they wanted to biopsy was a benign tumor, but it's a type of benign tumor that can turn into breast cancer. So one way or another, I was gonna have to get it removed. It just would have taken longer to figure out what it was. So it's been a journey. Recovering from surgery was difficult. It was more difficult than I anticipated. And one of the things that has really helped me is being connected with FORCE. I don't know exactly what FORCE stands for. It's Facing Our Risk thing. But it's a group for genetic hereditary cancers and previvors. And so I went to my first support group actually the week that I got surgery. If I got surgery on a Monday, I was there on Thursday. And it was really helpful getting the opportunity to talk to people who had to make the same decisions that I had. Because in talking to close friends about this surgery and the decision, they were saying, you're so brave. You know, there are so many people who would have just ignored all of this. They wouldn't have even gotten the testing done, let alone made the decision to get, you know, a life-changing surgery. But I felt like that wasn't really, I feel like I didn't really have a decision to make. And that probably says a lot about my mindset, that it's not too often that I experience fear. And so I wasn't afraid of getting surgery. I was more afraid every time I got results, you know, but to just sit and wait for something bad to happen to me, my life belongs to me way too much than doing that. That wasn't gonna make me feel better to pretend that this wasn't a real risk. Going to FORCE has been really helpful. I think being honest about having surgery has been difficult, but there is this complexity because it involves such an intimate area of the body. Like I made a point to tell some of my friends that I had this surgery because I didn't want anybody to like register but not be able to say, where are your boobs? Because there aren't too many people that I have that relationship with. And I will say that when it came down to actually deciding like what reconstruction to have and stuff like that, like I said, if you're interested, I'll make a video because I went kind of an abnormal route, but really it was just between me and my husband, and not even because like his aesthetic preferences matter that much, but because as my spouse, he is my thought partner. And the person that knows me best. And so he would, God bless him, he came with me to almost every single appointment in preparation for surgery. If he wasn't there, he was on the phone. He, at one point, was like calling the surgical scheduler so much that he would like call the office. She would say, hello, it's so-and-so. And then be like, oh, hey, Sean, because they just built up so much rapport, and he was having to call so often to get his paperwork straightened out to take time to take care of me. And so I would say really like the biggest thing is exactly like FORCE's name, facing our risk, right? You have to be honest about what this experience is. It's not typical. It's not something that most people go through, but there is a big community of people that experience it. So I definitely recommend getting connected with them, and I'll leave their information down below. having, even if it's just one person, right? And thankfully for me, I have loving and supportive close friends, and I also have as close to as perfect of a husband as possible, who carried me through this. And then also see multiple people, you know? I lucked out in that I really like my breast surgeon, I really like my plastic surgeon. But I saw 2 genetic counselors, and it's not because one was better than the other necessarily, but because I just switched where I was living. But, you know, it's worth getting multiple opinions if you don't like what you're hearing. Like I said, for me, I'm such a bull of a person, like just so stubborn and just plowing through life that I was like, whatever. But I could imagine, you know, somebody might be 10 toes down that you need to get surgery, and then another doctor might tell you, no, that I haven't experienced that. So see multiple people, and really feel, I want whoever watches to feel empowered to make the best choice for their self, because I do feel like I made the best choice for myself. It hasn't been easy, and I think that's the thing, right? Is for people to say, well, you're so brave, you know, it's not like this is an easy decision or something easy to recover from, but I felt like I didn't have any other choice, you know? Before having my mastectomies, I, without realizing it, found myself thinking, okay, if I die at 40, right? Like I have to have all my ducks in a row and make sure that I'm not living with regrets and stuff like that. Another thing that I would recommend tangential to the mastectomies, but I think important if you're in this position, is odds are if you're having preventative surgery, you have either had a mutation diagnosed or you have a family member that's passed away. I went through grief counseling, and it was really helpful for me to even realize that I was having that thought process of, okay, I'm gonna die at 40. My sister died when I was 25. And I have found myself in the past couple of years able to think long-term and able to envision myself being old. And that's something that, no, when I'm old, I won't get to have that with my sister. But one of the best things that I can do to honor her is to do everything in my power to live as long and healthy and well as possible. So, you know, it's heavy stuff, but that's, I told y'all, I don't know what type of word you would use, pragmatic perhaps, but that's just the circumstances, you know? So it's been about 2.5 months since I had surgery, and I'm finally, you know, starting to feel like myself. I don't know that I'll ever feel the same, just because like muscles got moved around and stuff like that, but starting to feel better. And I would be happy to in any way be a resource to folks who are going through this. So thank you for watching. Please leave any questions or comments down below. We might need to take it, you know, out of the comments. It's medical information. And it's quite emotional stuff. And then, like I said, also, if you want details about like what kind of surgery I got done, what are my plans for reconstruction, you know, what did I talk to my plastic surgeon about, and more of the aesthetic side of things as opposed to just the health side, please let me know in the comments and I'll be happy to do a part 2. Thank you for watching, and I'll see you in my next video.